welcome to mindbraintalks, the place where you find diverse and scientifically accurate information regarding psychology, neuropsychology, neurosciences and research methods every single week. My name is Bruno Faustino. I am a licensed clinical psychologist and neuropsychologist who's been working as a therapist, researcher and educator for the past few years. Here, I discuss and describe different topics from psychology to neurosciences, and I try to explain them the best as I can for you to understand and for you to learn something about it. All contents here are just for educational purposes, and it's not intended to diagnose any psychiatric condition or neurological disorder. So, without further delay, let's jump for today's content. Today's video is focused on psychotherapy. Today, I will describe to you the main theoretical approaches that clinical psychologists, psychotherapists and psychiatrists tend to use to understand and describe normal and abnormal behavior. Also, these theoretical approaches tend to have different forms or similar forms of case conceptualization and clinical decision making, and we'll take a brief look on them. So if you like psychotherapy, this is a video right for you. So now let's look to the manuals that I recommend to you. The first is Introduction to Clinical Psychology. The second, the Oxford Handbook of Clinical Psychology. The third, Clinical Handbook of Psychological Disorders. The fourth, What's Work for Whom, second edition, a critical review of psychotherapy research. The fifth, the Oxford Handbook of Research Strategies for Clinical Psychology. The sixth, Clinical Psychology, Science, Practice and Culture. The seventh, the Handbook of Psychotherapy Integration from John Norcross and Marvin Goldfried, which is a very good manual. Counseling and Psychotherapy Theories in Context and Practice. And the last one, a similar one to the previous, Theory and Practice of Counseling and Psychotherapy, the 6th edition from Richard Nelson Jones. So, now let's see what is psychotherapy. Psychotherapy is the informed and intentional application of clinical methods and interpersonal stances derived from established psychological principles for the purpose of assisting people to modify their behaviors, cognitions, emotions, and/or other personal characteristics in directions that the participants deem desirable. This is a very wide definition that came up from Norcross in 1990. This definition, it's a widely accepted definition, and that's why I'll give it to you here. So now let's look to different aspects of psychotherapy. Psychotherapy may be viewed as a specialization typically done by psychologists and psychiatrists. Typically, psychotherapy must be or may be symptom-focused or structurally or personality-focused, when an individual must structure some aspects of personality, or when individuals need to reduce some symptoms of anxiety, depression, anger, and so forth. Psychotherapy may unfold through different stages and may work through different mechanisms. However, we will look to this in the future, okay? And typically, psychotherapists tend to use an evidence-based treatment, which is a treatment that has been studied in paradigm of a process and outcome. So now let's look to the major theoretical orientations. The first is psychoanalysis and psychodynamic psychotherapy. The second is behavior therapy. The third is cognitive and cognitive behavior-oriented therapies. The fourth is humanistic or experiential approaches. Systemic or family system therapy. And the last one is integrative psychotherapy. So now let's look a little bit more in detail these different theoretical approaches, and we'll try to see some essentials from each approach, okay? So let's go. So psychoanalysis and psychodynamic psychotherapy is the first one. Psychoanalytical approach was founded by Freud in the beginning of the 20th century and was focused on the unconscious domains of the human mind. Constructs of ego, id, superego, and transference were the main constructs from this theoretical approach. So Freud was the main proponent of this theoretical approach. However, Carl Jung and John Bowlby were also very important and had major contributions to psychoanalytic theory. However, during the 50s, 60s, and 70s, many new approaches were developed as alternatives to the traditional psychodynamic approach. and we can differentiate four main branches: Freudian psychology, ego psychology, object relation psychology, and self-psychology. And from this differentiation, different forms of therapy emerge, such as brief psychodynamic psychotherapy or, more recently, mentalization-based therapy. So, now let's look to behavior therapy. Behavior therapy applies theories of learning and conditioning to the understanding of human behavior and the treatment of behavioral and psychological problems. Typically, is based on learning principles, operant and classical condition, and social learning theory. Eysenck, Skinner, Wolpe, and Lazarus were very important in the development of behavior therapy. So now let's look to cognitive or cognitive behavior-oriented therapies. Became popular during the 1970s and is based on the principle of the relationship between cognition, emotions, and behavior. Typically, cognitive or cognitive-oriented psychotherapists try to understand how cognitive structures, such as schemas, expectations, assumptions, or attributions, and cognitive processes, such as cognitive biases or distortion, tend to influence normal and abnormal behavior. Typically, we can call cognitive or cognitive behavior therapy as the first form of the integrative psychotherapy because it was the integration of behavior and cognitive assumptions. So, in cognitive behavior therapy, there are different models and approaches. The first is the rational emotion behavior therapy from Ellis. The second and the most popular, cognitive therapy from Beck. The third, cognitive restructuring from Mahoney. The fourth, stress inoculation and self-talk from Mike and Baum. And the last one, the concept of self-efficacy from Bandura. So now we can have a third generation of CBT, which has incorporated mindfulness, acceptance, and self-compassion methods. The first is acceptance and commitment therapy. The second, compassion-focused therapy. The third, mindfulness-based cognitive therapy, and metacognitive therapy. There are lots of third generation CBT that were not mentioned here, okay? However, in the future, I will produce different videos where we can take a deep look on them, okay? So, as you are seeing, in cognitive or cognitive behavior-oriented psychotherapies, there are different approaches or different subfields that all share in common the main theoretical or the main principles underlying the cognitive behavior therapy, which is the cognition mediates the relationships between emotions and behavior. However, despite this theoretical assumption of the traditional cognitive behavior therapy, the third generation of cognitive behavior therapies added new assumptions which led to new theoretical principles and new clinical applications. But in future videos, we will explain these assumptions with more depth, okay? So now let's look to humanistic or experiential approaches. Typically, they employed philosophy, existentialism, and theories of human growth and potential to understand human behavior. They were focused on the patient's experience and phenomenology and offered warmth, empathy, and unconditional positive regard. The humanistic approach that is more recognizable is the Carl Rogers approach, which was a client-centered and phenomenological approach. However, Maslow, Peirce, and Viktor Frankl are major theorists that were very important in expanding the humanistic approach. So now let's look to systemic or family systems therapy. Family systems approach emerged from the Bateson project during the 1950s and were focused on the utilization of the entire family in the understanding and treatment of psychological disorders. Typically, systemic psychotherapies focus on different aspects and functions of family relationships. Main authors that we can recognize from this approach are Bowen, Bertalanffy, Bronfenbrenner, and Belinsky. So now let's look to other theoretical approach, which is the integrative psychotherapy. This type of approach tries to combine different aspects of other theoretical approaches in order to develop a new case conceptualization and clinical decision making tailored specifically to the needs, styles of communication, and features or characteristics of each individual. So now let's look to this. Researchers and clinicians felt dissatisfied with strict adherence to one particular theory or theoretical orientation. So, they try to focus on integration of concepts, principles and strategies from different theoretical orientations to fit patients' characteristics and specific needs. So, this notion was based that every theoretical approach has some level of evidence. So, psychotherapists may use one of these four theoretical approaches to work within an integrative psychotherapy paradigm. The first is common factors, the second is theoretical integration, the third is technical equitism, and the fourth is integrative assimilation. In the future, I will produce different videos talking about these specific ways of psychotherapy integration, okay? So now let's look to some therapies that were based on one of these principles of psychotherapy integration. Clinical psychodynamics, trans-theoretical process of change, cognitive behavior simulation therapy, systematic treatment selection, and multimodal therapy. However, there are other forms of psychotherapies that were based in these four integration principles. So, emotion-focused therapy, schema therapy, metacognitive interpersonal therapy, paradigmatic complementary metamodel, and cognitive analytic therapy. So now let's just summarize the contents of today. Psychotherapy may be viewed as a specialization based on psychological approaches. When we look to psychotherapy, we can look to traditional approaches such as psychoanalysis, CBT, but we can also look to modern approaches such as third-generation CBT, brief psychodynamic, and we have this last theoretical approach, which is integrative psychotherapy, that is focused on the use of different elements from other theoretical approaches in order to enhance case conceptualization and clinical decision making. Well, it's all for today. Don't forget to see the video description regarding today's theme to see the manuals and the books that I recommend to you. Also, if you like what I'm doing here, please consider to subscribe and hit the bell for notifications. You may also use the comment section below to express your mind and to say something about it. Welcome to Mind Brain Talks, and I hope to see you in the next video. Bye!